Your preceptors will also review with you kind of like what your site expectations are. So certainly there's expectations of you as a student from the program perspective, but each individual site's going to have different individual site expectations of how their precepting is conducted, how they have students on their units or on their site and what that means. So again, probably your first several days with your preceptor will be having a lot of these conversations. Other site expectations, what you're going to find, and this is again something we're going to talk a lot about throughout the course of the year, they have different policies and procedures, particularly around lactation care. So kind of understanding, what does my particular site say about particular lactation issues? One example I'll just give right off the bat is how do we care for a late preterm baby? Every site tends to have a little bit different policy and procedure on that. So it's good to know what your site's policies and procedures are caring for a late preterm baby. You might find they have we don't have like uniform necessarily uniform procedures and policies in place on how do we deal with a baby who has hypoglycemia. You're going to find some differences across sites on how they approach that and what their policies are and their procedures are. So your preceptor will certainly go through those with you. If what I would suggest is, as things come up, as issues come up, say you're going into a room with a family with a late preterm baby, you can always ask your preceptor, do you guys have a written policy on that? And can I get a copy of that written policy? Can I take a look at it? That can be really helpful information for you as you not only kind of navigate, approach to that family, but then why you might be seeing what the lactation consultant's doing, why you might be hearing what the nurses are talking about, because it adheres to a certain policy they have.